Okay, let's dive straight in. We're tackling something really important today, and honestly, quite alarming if you're a cat person.
hmm
Feline panleukopenia.
Yeah.
You might have heard it called feline distemper, or maybe feline parvovirus. It's known for being super contagious and often really tragically fatal.
It really is.
Yeah.
And looking through the material we've got for this deep dive,
Yeah.
you see right away this isn't, just some minor bug. It's serious stuff.
Totally. Demands attention because of how bad it can be, especially, like you said, for kittens.
Exactly.
So our mission here, for you listening, is to take all this information we've gathered, the research, the vet notes, all of it, and really break down feline panleukopenia.
The tour of it.
Yeah, what causes it, how it spreads, the key signs you absolutely need to look out for, how vets figure it out, how they treat it, and the big one, how to stop it from happening in the first place.
Sort of a quick, thorough briefing from the sources.
Exactly, getting you informed fast.
It's about pulling out that essential knowledge, giving you that clear picture so you're, aware and prepared.
Okay, so let's start right at the basics. Feline panleukopenia. What are we actually dealing with here, fundamentally?
Well, based on the sources, it's a virus. It's caused by the feline parvovirus, FPV for short. It's a tiny DNA virus from the Parvoviridae family.
Yeah, right, a parvovirus, kind of like the one people know about with dogs.
Precisely. And what really jumps out from all the sources is just how incredibly hardy this virus is. It's described as, extremely resilient.
Hardy how?
It can survive out there in the environment for months.
Yeah.
Sometimes, believe it or not, even years if the conditions are right. And it laughs off a lot of common disinfectants.
Wow, years. Okay, that changes things. Thinking about cleaning, that's tough.
It makes prevention really tricky, doesn't it?
So if it's that tough, how does it actually move around? How does it spread?
So the main way is direct contact with an infected cat's bodily fluids, especially feces. The virus is shed in really high amounts there.
Okay, direct contact. Makes sense.
But, and this is a huge problem, indirect spread is super common too. The virus hitches a ride on contaminated stuff.
Yeah.
Food bowls, water bowls, bedding, litter boxes.
Your ears, people's clothes.
Yep, even hands and clothing. And what's really sneaky is that infected cats can start shedding massive amounts of this virus before they even look sick.
Oh, great. So they're contagious, but seem fine, spreading this super tough virus around without anyone knowing.
Exactly.
So once it gets into a cat, what's its game plan? What does it attack?
This is really key to understanding it. The virus loves rapidly dividing cells. It makes beeline for the cells lining the gut, cells being made in the bone marrow, and the lymphoid tissues.
The immune system stuff.
Right, the immune system headquarters, basically.
And targeting those fast-reproducing cells. Is that where the name panleukopenia comes from? What's that mean?
Absolutely spot on. Panleukopenia literally means a deficiency of all white blood cells. Pan means all, leuko is white, penia is deficiency. Because the virus just decimates those cells in the bone marrow and lymphoid tissue, the cat's body just can't keep up production. White blood cell counts plummet.
Leading to severe immunosuppression.
Exactly. Their ability to fight off anything just craters.
That sounds awful. And the sources mentioned something particularly devastating for pregnant cats, didn't they?
Yes, that's a really critical and frankly heartbreaking aspect. The virus can actually cross the placenta.
Oh, no.
It can infect the kittens while they're still developing. This can cause, abortions, stillbirths,
Yeah.
or if the kittens survive the infection inside.
There are still problems.
Yeah, the virus can damage their developing brain, specifically the cerebellum.
The part that handles coordination and balance.
That's the one. It leads to something called cerebellar hypoplasia. Basically, the cerebellum doesn't develop properly. Kittens born with this often have lifelong neurological issues.
Like what kind of issues?
You'll see a real lack of coordination. They stumble a lot. Vets call it ataxia. And tremors, especially when they try to move or focus on something. It's quite distinct.
Gosh, that's rough. Okay, so we know how it works, how it spreads. What are the actual signs? What should you be looking for if you have a cat?
Well, the incubation period is usually pretty quick, typically just 2 to 7 days between getting exposed and symptoms starting.
And when they start, is it gradual?
No, usually the opposite. The onset is often really sudden, really severe, especially in young kittens.
Looking through the material, what were the sort of first things you might notice? The earliest signs?
Often it starts with the just general stuff like profound lethargy. The cat seems totally wiped out, no energy, depression, hiding away.
Just not themselves at all.
Right. And they often get a high fever initially. Plus, A really significant sudden loss of appetite is very, very common.
And since it attacks the gut, I'm guessing severe stomach issues follow?
Oh, absolutely. This is where it gets really obvious and, frankly, distressing to witness. We're talking persistent, severe vomiting.
Constant vomiting.
Yeah, pretty relentless. And then often profuse watery diarrhea. Sometimes it can even have blood in it. And you can tell they're in pain, abdominal pain.
And all that fluid loss, vomiting, diarrhea, dehydration must be a huge danger.
It's critical. You'll see the signs: sunken eyes, their gums feel dry, tacky, not moist like they should be.
Skin tenting.
Yeah, if you gently lift the skin on their back, it might go back really slowly. Poor skin elasticity. They lose weight incredibly fast, obviously, from not eating and losing fluids. They get very weak.
And the sources mention, sometimes it's just sudden death.
Tragically, yes, that can happen, especially with very young or already weak kittens.
And just looping back quickly, the specific signs for pregnant cats and those kittens affected inside.
Right. For the pregnant queen, you might see her lose the litter late in pregnancy or stillbirths. And for kittens that survive that in utero exposure, it's those neurological signs we talked about.
Yeah.
The wobbly, uncoordinated movement, the tremors, poor balance from that underdeveloped cerebellum.
It sounds incredibly aggressive, especially for kittens under, say, 6 months. The sources really hammer home that without aggressive treatment, it's often fatal for them.
That's right. And that's exactly why understanding these signs is so vital for you. Recognizing them fast, getting to the vet immediately, that's what gives the cat its best shot.
Okay, so you see these red flags, you rush your cat in. How does the vet actually confirm it is feline panleukopenia?
Well, it's usually a combination approach. They look at the clinical signs you've described, the cat's history like vaccination status, any known exposure risks, and then specific diagnostic tests.
Why is getting that specific diagnosis so important? Can't they just treat the symptoms?
Because, as we mentioned, some symptoms overlap with other really serious things in cats. Feline leukemia, FIP, even some poisonings can look similar initially. You need to know what you're fighting to treat it right, and also, critically, to prevent spread if you have other cats.
Right, makes sense. What does the vet look for in the physical exam itself?
They'll be assessing the cat's overall condition, checking for dehydration levels, taking the temperature, feeling the abdomen for pain or discomfort, noting how lethargic or out of it the cat seems.
And then they move on to lab work.
Yes, lab tests are absolutely key for confirmation. A complete blood count, a CBC, is often the big one.
Why's that?
Because the classic hallmark finding in most panleukopenia cases is a really, really low white blood cell count, often dramatically low. That confirms the panleukopenia, the lack of white cells.
Which specific white cells?
Usually you'll see very low neutrophils, that's neutropenia, and low lymphocytes, lymphopenia.
Yeah.
In really bad cases, they might also see low red blood cells, anemia, or even low platelets, thrombocytopenia.
Okay. What about other blood tests, like a chemistry panel?
Yeah, biochemical profile. That gives the vet clues about organ function and hydration. It'll likely show electrolyte imbalances from all the fluid loss, signs of dehydration like elevated kidney values, and potentially low blood sugar hypoglycemia, which kittens are especially prone to.
Interesting point from the sources. One of the quick tests they use, the fecal ELISA test. It was originally made for dog parvo. Why is that?
That is a fascinating detail. It really underlines how closely related the feline panleukopenia virus is to canine parvovirus type 2. They're genetic cousins, basically.
So the dog test works on cats.
Often, yeah. Because they're so similar antigenically, a test designed to detect the canine virus can frequently pick up the feline one in feces. It's a quick, useful test vets can often do right there in the clinic.
Quick sounds good, but are there downsides? Any catches mentioned?
Yes, definitely. The sources mentioned potential false positives, especially if a cat was recently vaccinated, say within 5 to 12 days, with a modified live FPV vaccine. The test might just be picking up the weakened vaccine virus.
Okay, so timing matters.
And you can also get false negatives. Maybe the cat just isn't shedding much virus in its stool right at the moment that specific sample was collected.
So helpful, but needs careful interpretation alongside everything else. Is there a more accurate sort of gold standard test?
Yes, PCR testing. Polymerase chain reaction. That's more sensitive and specific because it actually detects the virus's genetic material, its DNA, in the fecal sample. That gives a much more definitive yes or no.
And sadly, if a cat doesn't make it, the sources mention what vets might find during a necropsy, an autopsy.
Right. Post-mortem exams and looking at tissues under a microscope, histopathology, would show characteristic damage. Things like thickened intestinal walls, severe damage, actual necrosis of the gut lining, and clear depletion of cells in the bone marrow and lymph nodes confirms where the virus hit hardest.
Okay, so the diagnosis is in. It's feline panleukopenia. What's the plan? Is there a magic bullet antiviral drug for this tough virus?
And this is the really tough part, highlighted clearly in the sources. There is no specific antiviral treatment for FPV. There's no drug you can give that directly attacks and kills this virus once the cat is infected.
Wow, that's stark. So if you can't kill the virus, what can vets actually do?
The entire treatment approach boils down to aggressive supportive care. The whole goal is to manage the symptoms, keep the cat stable, hydrated, nourished, fighting secondary issues, basically, giving the cat's own immune system the support and time it needs to hopefully overcome the infection itself.
Okay, supportive care. What does that usually look like? It sounds intense.
It usually is. Most cats with confirmed or even strongly suspected FPV, especially kittens, need to be hospitalized, often in intensive care with 247 monitoring.
What's the first priority?
Fluid therapy. Intravenous 4V fluids are absolutely essential. Non-negotiable, really. They're needed to correct that severe dehydration, fix the electrolyte imbalances, and combat shock. And like we mentioned, kittens get hypoglycemic easily, so often glucose sugar needs to be added right into their 5V fluids.
Makes sense. Battling the dehydration. What about the awful vomiting and diarrhea?
Right. They try to control those symptoms with medication. Antiemetics drugs like meropenem, brand name Cerenia or ondansetron, are used to reduce the vomiting. And sometimes gastroprotectants like famotidine or omeprazole might be given to help protect the damaged stomach lining.
Okay, fluids, anti-vomiting meds. But hang on, you said no antiviral. Why give antibiotics? Those fight bacteria. Right, this is a virus.
That's a really key point, and yeah, it might seem counterintuitive, but the sources explain why. The antibiotics aren't for the panleukopenia virus itself. They're crucial to prevent or treat secondary bacterial infections.
Ah, because the immune system is shot.
Exactly. Remember how the virus wrecks the gut lining and wipes out the white blood cells? That combination leaves the cat incredibly vulnerable. Bacteria that are normally kept in check in the gut or the environment can suddenly invade and cause overwhelming infections.
So the antibiotics are holding the line against those secondary invaders.
Precisely. Things like ampicillin, cefazolin, or metronidazole mentioned in the sources are vital to give the cat a chance against those opportunistic bacteria while its immune system is down.
Got it. Okay, what about feeding them? If they're that sick, vomiting, they can't be eating.
Often, no. And nutritional support is really important for their chances of recovery. If a cat won't or can't eat, vets might need to use things like syringe feeding or even place-feeding tubes.
Tubes, like down the nose.
Sometimes a nasogastric tube, yes, or an esophagostomy tube which goes into the esophagus through the neck. It sounds drastic, but it's sometimes the only way to get vital calories and nutrients into them to fuel healing.
And in the absolute worst cases, really severe situations.
Yeah, if a cat becomes severely anemic or develops problems with blood clotting because the bone marrow is so suppressed, then blood transfusions or plasma transfusions might be considered to help stabilize them.
So it's really like intensive care nursing, fluids, managing symptoms, fighting off secondary infections, getting nutrition in, basically supporting the body through this massive viral assault while hoping the immune system can rally.
That's a very good summary, yes.
Given all that effort, what are the odds? What's the prognosis typically like?
It really varies quite a bit. It depends heavily on the cat's age, its overall health before getting sick, and, this is critical, how quickly that aggressive supportive treatment gets started.
And the outlook sounds pretty bleak for the very young ones.
Yes, the sources really emphasize that kittens under 8 weeks old, they have the poorest prognosis. If they don't get that intensive supportive care, the mortality rate can be, well, it approaches 90%.
90%, wow. That is just devastating.
It's incredibly high, yes. Truly tragic.
But there's more hope for older kittens and adult cats.
There is, thankfully. If they get prompt, intensive veterinary care, the survival rates for older kittens and adults are significantly better. The sources suggest typically somewhere in the range of 50% to 70%.
Okay, so 50 to 70%. Still serious, but much better odds.
Absolutely. It really drives home that while the supportive care isn't a direct cure for the virus, it absolutely can be the difference between life and death.
And if they do manage to pull through, what's recovery like? Are there lingering effects?
Generally, cats that survive make a full recovery from the systemic illness. And the good news is they usually develop lifelong immunity. They're very unlikely to get sick with FPV again.
That's great news for survivors.
The main exception, though, are those kittens we mentioned who were infected in utero and had that cerebellar damage. They will likely have those permanent neurological signs, the wobbliness, the tremors. That doesn't go away.
Right. Okay, so recovery is possible, often complete, but it takes a huge effort, and the initial illness is incredibly dangerous. Which brings us squarely back to prevention, right? That has to be the best approach.
Absolutely, without a doubt. Prevention is the cornerstone. It's how we control feline panleukopenia. And based on everything in the sources, the single most important tool we have is vaccination.
Good vaccines exist for this.
Yes, highly effective modified live vaccines are available, and they are considered a core vaccine. That means every cat should get it, unless there's a specific medical reason not to.
What's the typical schedule? What should you, the listener, know about vaccine timing?
So the standard kitten series usually starts around 6 to 8 weeks of age. Then they need booster shots every 3 to 4 weeks until they're at least 16 weeks old.
Why so many boosters?
It's to make sure we get past any lingering immunity they got from their mother's milk, which can interfere with the vaccine working early on. You need to keep boosting until their own immune system reliably responds.
Okay, so series until 16 weeks minimum. Then what?
Then they get another booster about a year later. After that, boosters are typically given every 1 to 3 years. Environmental control is also hugely important, exactly because this virus is so resistant. Disinfection is key.
What kind of disinfectant does regular cleaner work?
No, many regular cleaners won't touch it. The sources specifically say you need a virucidal disinfectant that's proven effective against parvoviruses. And they give a specific practical recommendation. Bleach.
Household bleach.
Yes, diluted properly. 1 part regular household bleach to 32 parts water. That's a 1.32 dilution. You need to clean away any organic material first, like feces or vomit, and then apply the diluted bleach solution and let it sit for the recommended contact time, usually about 10 minutes before rinsing.
That's really good practical info. 1.32 bleach solution.
It is, because just wiping things down isn't enough for this virus. And of course, strict isolation for any cat that is infected. They need to be kept completely separate from other cats for at least 2 weeks, often longer, until they're definitely not shedding virus anymore.
And for people handling sick cats,
rigorous biosecurity. Wear protective clothing, gloves, change clothes before handling healthy cats, and meticulous hand washing. Basic hygiene becomes critical.
I can only imagine this is a nightmare in places with lots of cats together, like shelters.
It absolutely is. Shelters, rescues, even large feral cat colonies. They are prime spots for outbreaks. The sources stress that controlling FP in those settings needs a multi-pronged approach. Consistent vaccination protocols for all incoming cats, strategies to manage the population and avoid overcrowding, and really strict regular cleaning and disinfection with the right products, like that bleach solution.
This is all incredibly useful, actionable information for you listening. Whether you've got one cat at home you adore, or you're involved with rescue or TNR, knowing how this spreads, what signs to jump on, and crucially, how to prevent it with vaccines and proper cleaning, it really gives you the power to protect cats.
It does. That informed awareness, combined with diligent preventive care vaccination, hygiene, it's truly the best shield we have against this really nasty disease.
So that wraps up our deep dive into feline panleukopenia for today. We've gone through how tough this virus is, how it attacks those dividing cells and knocks out the immune system.
The sudden, severe signs you need to recognize.
How vets diagnose it, the fact there's no magic cure, but intensive supportive care can work.
And, most importantly, the power of prevention. Vaccination and disinfection being key.
Absolutely.
Understanding how serious it is, but also knowing effective prevention exists, really empowers cat owners and everyone who cares for cats to take those protective steps.
Definitely. Now, before we sign off, here's something to chew on, something that really popped out from the source material. We mentioned that the quick fecal test, the ELISA, often used for cat panleukopenia, was actually designed for dog parvo because the viruses are so closely related.
Right, that genetic link.
So ponder this. What does that close relationship between a major cat virus and a major dog virus really tell us about how these kinds of viruses might evolve, how they might shift, maybe even jump between species over long periods? And why is knowing about that family connection important for more than just picking the right diagnostic test?
It's a really interesting window into viral evolution, isn't it? How these pathogens are related and how they might impact different hosts.
Indeed. Something to think about further if you're curious. Thanks so much for joining us on this deep dive.